Okay, so with trauma and orthopedic, okay, remember it's an orthopedic word. Is that okay? Great. And it's more like surgical, you know, and a surgical area. Okay, great. Now, once they give you the care plan over there, as usual, the first thing that you do is you divide the care plan into what? Straight into 4. That is if you want to do or design 4 care plans. If you want to design 3 care plans, you divide the care plan into 3, just as you can see on the slide. Okay, so that's the first thing that you do. Please, everything that you are doing is about time. Is that okay? So once, if you know you are focusing on designing 3 care plans, as in the inside of the care plan, straight, the first thing, divide the care plan into 3 before you start writing anything. Okay, if you want to do 4 care plans, you divide it into 4. You remember that all the time the vigilators are going to tell you the time you are starting, or the examiner will let you know that, oh, you are starting at 8, or the time is 9:30, you are starting. Then quickly you write the date and time there. That's the first thing you are doing. Even before you turn the front page to write your index number and sign. That's the first thing. So quickly you write. So the examiners will tell you, oh, it's 9:30, so you can start. Then quickly, today's date you write. Today is what date? You write today's date quickly. Today is 31st. So you write 31st. So in the first box, you write 31st 07 2025. Then you write the time. If you started at 9 a.m. The second box, 31st 07 2025. Then you write the time. You add 5 minutes to the first time. So if you wrote 9 a.m., then the second box, 9:05 a.m. Then the next box, you write 31st 07 2025. Then you write the time. You add 5 minutes. So that will be 9:10. If you are doing 4 care plans, then it means you would have to go to the next box. Now remember, it's not a problem you divided the care plan into 4, but then you designed 3. It's not a problem. You'll not be penalized. Is that okay? So maybe you are not sure you may be able to design 4 care plan, but you want to divide it into 4. It's not a problem at all. The examiner is not going to mark or score the divisions you've made. We are going to score what you've written. So you divided the care plan into 4. You've designed 3 care plans. That will be marked perfectly. Is that okay? Great. So that's the first thing that you do. Once you do that, then now you turn to the front page of the care plan. The first thing you are going to write, you write your candidate index number and sign. That's the first thing you are going to write. Your candidate index number, then you sign. Then straight, you come to the allergies, and then you write no known allergies. Just as I keep saying, every day, the candidates that come, someone still writes the patient strength are the allergies. Every day. Even though we keep emphasizing on it, every day people are still committing that error. Is that okay? Good. So you write, the first thing you write, no known allergies. So after writing your index number and signing, the next thing you write is the no known allergies. Then quickly you go to the routine care. You fill all the details at the routine care. So TPR, usually you write 4 hourly. There are other details about the things that go on in the routine care, which I've already dealt with on the page. So I'm not going to talk so much here. So BP 4 hourly, I believe by now all of you are masters of the routine care. So the diet, the normal diet or the special diet. The fluids, either you write liberal fluid or intravenous fluids. Details of all these are already on the page. Intake and output is either monitored or strictly monitored. Please, at the orthopedic ward, you can't have any patient that intake and output. You can write not monitored. And in fact, there is no patient that you can say this condition, intake and output, is not monitored. Ideally, those days when admission, we used to do it on paper base. The papers that you use for admission, check. Intake and output chart. It's one of the papers for admission. Do you get it? It's one of the required papers when you are doing admission. So that should tell you all patients intake and output should be monitored. So it's either you are doing monitored or strictly monitored. If it is an immediate post-op case, or if it is a post-op case, usually intake and output should be strictly monitored. If the patient is on urethral catheter, usually it should be strictly monitored. If a patient is having any underlying renal condition or heart condition, intake and output should be strictly monitored. Oral hygiene twice daily. bath and you write twice daily. Sometimes some of you may add certain details. It's not a problem. So twice daily with Pepsodent, all those things, fine. If you have time to write all those things, it's good. Okay. The bathing twice daily, the urine testing done on admission, the body weight done on admission, the activity, either you are writing active or passive, and details of how you get to write active or get to write passive. All those things has been dealt with on the page. Then quickly, you turn to the back page of the care plan. Now listen carefully. Listen carefully. With orthopedic ward, the lady going to orthopedic ward, Mary Marfo, listen carefully. With orthopedic ward, okay, once you know that the condition is a fracture, please, the investigation, the first thing you write is X-ray. Listen carefully. So once you see the diagnosis and the diagnosis, you see fracture inside. Listen carefully. The investigation side, the first thing you write is X-ray. Don't search for anything. Then the results section, write the diagnosis there again. Let me repeat it again. Orthopedic ward, once you see that the condition is a fracture, once you read the diagnosis and you see that fracture is inside, the investigation side, the first thing you have to write is X-ray. Write X-ray of that leg. So if the fracture is on the right leg, write X-ray of the right leg. Then the results section, write the diagnosis there. So let's see, the diagnosis of the patient is right femur fracture. The investigation, write X-ray of the right leg. Then the results, write the diagnosis there again. Right femur fracture, write it there again. That is it. Then now you can go and look for the full blood count. All patients on the orthopedic ward, they are having a full blood count. If they are working them for surgery, they will add BUE and creatinine to it. So for orthopedic ward, all the patients are having BUE and creatinine, and then full blood count results. But what I'm saying is that once you confirm that a patient's case is fracture, it's one of the easiest care plans you can have to, and one of the easiest way patients you can have to design a care plan. So once you see it's a fracture, the diagnosis, usually they will use this triangle sign for the diagnosis. So they write triangle, then a sentence, that sentence is the diagnosis. Once you see that there is fracture inside, straight away, the investigation side, the first thing you write, where that fracture is, if it's on the right leg, you write X-ray of the right leg. Then the results section, you write the same diagnosis of the patient there. Then you now write the full blood count like this. So you write the full blood count. So you see something like this. You see X-ray of the left leg. Then the results section, you write left femur fracture. The same diagnosis, because it's the X-ray the doctors will use to make the diagnosis. Is that okay? Then your other labs, like the full blood count. Then under the full blood count, you write red blood cell, white blood cell, hemoglobin, and then platelets. You can add platelets to it. You get it? Then you write their corresponding results. If you're able to write the X-ray, the full blood count, it's okay. Okay. Now, the other treatments, write no other treatments requested. For orthopedics, usually, if they will do a physiotherapy for a patient, usually it will be towards the discharge. Okay, so if the patient is, let's say, usually if maybe 3 days prior to discharge, the doctors will do their calculations or their review. If they think in 3 days' time they will discharge the patient and the patient requires physiotherapy, that is when they will discharge. So it's not all the patients on the orthopedic ward who are on physiotherapy, unlike other places that, it's something that is part of the interventions, the routine interventions that they give. Okay, so the other treatments, right? No other treatment requested, just as this, like this, right? No other treatment requested. Okay, great. Then the the medications. Okay, so the medications, you write their medications. Most of the patients there are on antibiotics, some are on paracetamol, analgesics, some are also on anticoagulants. In fact, anticoagulant therapy, analgesics, and then antibiotics is a common treatment at orthopedic ward, especially if the patient is a post-op case. So you are going to see medications like paracetamol, diclofenac, okay, medications like tramadol, celecoxib. These are common medications you are going to see the patients are being managed on. You get it? Now, most of the time, the medications will not be complete dosage in the orthopedic ward. So the doctors wouldn't add the duration to it. So you have to add until review like this. So for example, you go and meet that the doctor have written tablet paracetamol 1 gram 8 hourly. It's not a complete dosage. So add until reviewed. That is what you are going to see. And there are times that the treatment sheet, the doctors wouldn't write the date requested or the date prescribed on the treatment sheet. So use the date of admission over here. Use the date of admission over here. Okay. And that means if you are writing 3 medications, all the 3 medications, write their corresponding dates. Then the date completed, write not yet, not yet, not yet. Some people too do write ongoing, 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 which is also perfect. It's brilliant. Is that okay? So that is it. So this is how the transition will be. So once you are giving the care plan, you divide it into 3. If you are doing 4 care plan, you divide it into 4 like this. You write your dates, your date, your time. You are not going to do the inside care plan. You are just dividing and writing the date, time. So I said leave 5 minutes interval. If you started at 8, the first date time you are writing is 8. The second box, you add 5 minutes. The third box, you add 5 minutes. The fourth box, you add 5 minutes. Is that okay? If you are doing 3 care plans with the same thing, you divide it into 3. Okay. Now, after doing the division, you turn to the front page. The first thing you are writing is the candidate index number. Then you sign. Is that okay? Then the next thing you are going to write is you go straight to the allergies and write no known allergies. Then you do the routine care, which I've explained. Then I mentioned that the investigation for orthopedic, once you confirm the diagnosis, that triangle, the diagnosis there is fracture. Straight away, the investigation, the first thing, don't search for anything, just write X-ray. X-ray is like, it's like the preferential diagnosis for fracture on the orthopedic ward. Okay, so quickly you write X-ray of, if it is the right leg, X-ray of the right leg. Wherever the fracture is, you quickly write X-ray of the right leg. Then the results, write the diagnosis over there. Okay, then the other treatments, write no other treatment requested. Okay, then the medications, I've explained the medications. Then quickly you come to the front page again. You know the word you are going already, or D. You already know the word, so that shouldn't be a problem. Okay, that shouldn't be something you ask, or D. Is that okay? The bed number, in fact, the beds on that ward have not been numbered. So you decide the pattern of the numbering. You number the beds. Okay, and the fortunate thing with orthopedic wards is that the patient charts would be on their tables. Okay, the patient charts, okay, their bedside papers, all of them are around, they are available. And the nurses would always write the diagnosis on, a small sheet and attach it to their charts, which will make the care plan designing very simple for you. Is that okay? Good. Now, remember that it's not all the patients over there who have undergone a surgery. Okay. Now, the moment you see that the patient, so you go to the orthopedic ward, you see that the patient is having something like an antenna on the leg. We call it an explant. It tells you the patient. So you shouldn't go and say that you are going to check anything. You've seen something like an antenna on the patient's leg. That is an explant. We call it external fixation. So the patients have gone to the theater. Nobody should tell you. So for the orthopedic ward, there are some things that you can write them objectively. So you've seen an antenna is on the leg of the patient. That is an external fixator. So you quickly write open reduction external fixation. That is the procedure. That's the name of the procedure. So this is from a knowledge from surgery. This is not something you should search. You get it? Fine. Apart from that, there are other ways you can get to know patients have gone in for surgery. You get it? So I think I've explained all those details in our previous meetings, that there are some charts. We have something we call the post-anesthetic record, and then the post-op record. Okay, those charts, the post-anesthetic record is a gray sheet, very big. Usually the nurses will fold it into 2. It's a big sheet. Once you see that sheet, it tells you patients have gone for surgery. If you are fortunate and you see that sheet, on that sheet, the operation, everything will be on the sheet. Easy for you to just copy and then and go for it. Is that okay? If you don't see that sheet, you see consent form. Consent form is not a guarantee on the orthopedic ward. Patients have gone to the theater. So just be patient over there and make sure. If patients have gone for surgery, fine. You just do the right thing. You write. Okay. If patients have not gone to the theater, you just write no operation done. Simple. No operation done. Don't write not available. And don't write not yet. It's not all the patients who will go to the theater. Okay, so you write no operation done. Simple as that. No operation done. The date of discharge, all the time you write not yet. Okay, date of discharge, all the time you write not yet. Now, when you enter the ward, ask the nurses. Okay, ask the nurses which doctor is in charge of the ward. They will tell you. Do you get it? Which doctor is in charge of the ward? They will tell you. That's the first thing you do. Okay, inpatient number is going to be easy for you to identify. If you're able to get the labs, their inpatient numbers are on the lab, so it shouldn't be difficult. Okay, especially now that you've been to the ward for the first time. Great. So that is it. So now you are done with the front page. So after doing this, we assume you already have your 6 marks. Now let's do the care plan proper. Now for orthopedic ward, once they give you the patient, okay, the patient is having a fracture, straight away, you can do pain, okay? You can do a wound, okay? Once they give you a patient is having a fracture, the first thing you are going to write, patient's complaint of pain. Don't write patient's complaint of pain at the fracture site. It's wrong. Don't say fracture. If you tell us fracture site, then you are giving the examiner a work on how to go and now go and identify the fracture site. So patient's complaints of pain at the right leg, you get it. You can bring into bracket fracture site to make it even more specific. You get, but don't go and write patient complaint. Don't also go and write patient has wound at the right leg. No. You get it. Sorry, patient has wound at the fracture site. That one is also not accepted. Okay, so patient complains of pain at the right leg into bracket fracture site. Patient has a wound on the right leg. You see how it goes. And that one don't bring into bracket fracture site. Okay, patient has a wound on the right leg. Simple as that. Do you get it? Good. So you get pain, okay, automatically, and then you are also likely to get a wound, okay, on the orthopedic ward. Now, another thing that you can concentrate on the orthopedic ward, you can master on anxiety and write, okay. But apart from that, remember that because of the wound and because of the pain, usually they have challenge, performing their self-care activities. So you can write things like patient cannot bath without assistance. Okay, other prevailing problems may be there. Usually, most of the patients on orthopedic are very active patients. Don't go and write because you saw that patient is having, let's say, explants. You go and write passive. Please, the examiners, I know the examiners will be very particular about that. Most of the patients there are active patients. Okay, so the fact that patient is having a fracture doesn't mean the patient is passive. Some of them are active. They can sit without your assistance. They can turn, some can even move by themselves into the wheelchair. So they are active patients. Is that okay? So you can do things like patient cannot bath without assistance. But be careful when you are going to write things like patient cannot eat without assistance, unless they give you a very aged case, very aged patient that you think it is obvious such a problem is obvious. Apart from that, be very careful. Okay, good. So things like patient cannot bath without assistance, fine. If they give you a patient, the fracture is on the upper limb, the hand, then you are good to go. Patients cannot bath without assistance. Patients cannot eat without assistance. It's a very good diagnosis to write. Is that okay? Good. So quickly, you can have problems like, right, so you can have problems like patient's complaints of pain at the lower limb or patient complaints of pain on the right leg. You get it? Then the strength, patients can verbalize the intensity and location of the pain. Patients can verbalize the intensity and location of the pain. Then the diagnosis, acute pain into bracket right leg. You get it? Acute pain into bracket right leg related to, you get it? If the patient has gone in for the surgery, you can relate it to related to surgical intervention. If patients have not gone in for the surgery, then it means you have to relate it to you can either relate it to the disease process. Okay, related to the disease process. Okay, related to disease process. Okay, then the objective, patients level of pain will reduce within 45 minutes, as evidenced by patient verbalizing that pain has reduced. Nurse observing patients with a cheerful facial expression. Okay, then you reassure patients that measures will be taken to relieve pain. Assess patients' level of pain using a scale of 0 to 10. Employ diversional therapy such as listening to music. Assist patients into a comfortable position. Check patient vital signs, temperature, pulse, respiration, BP. Administer prescribed analgesics. Do you get it? Good. So that is it. Then you add the 45 minutes to the time you wrote at the date and time. Then you come and write it at the evaluation site. Is that okay? Great. Now, I mentioned that you should expect wound once the patient is having an open fracture. Okay. Once you assure patient is having something like an open fracture, straight. If it is an open fracture, straight away, you should be expecting wound. So that one, if there is a wound, impaired skin integrity, into bracket, wound. Don't write surgical wound. Into bracket, wound on the right leg. Impaired skin integrity, into bracket, wound on the right leg. Related to, if patient has gone in for surgery, you can relate it to surgical intervention. If patients have not gone in for surgery, you can relate it to disease process, into bracket, fracture. Okay, disease process, into bracket, fracture. Okay, disease process, into brackets, fracture. Simple as that. Okay, then the objective, patient wound will be cleaned within 45 minutes, as evidenced by nurse observing patient wound looking clean. Assess the state of patient wound, set a trolley for wound dressing, assist patient into a comfortable position, dress patient wound aseptically, educate and encourage patient to eat foods rich in proteins, administer prescribed antibiotics. Is that okay? Great. Then now you can do, if the patient is having a fracture or the problem is on the right upper or the upper limbs, is that okay? You can master on patients cannot bath without assistance. So something like patients cannot bath and care for his mouth without assistance. That is, if they give you a patient that's the patient is having the fracture, the problem is with the upper limb straight, patient cannot bath or care for his mouth without assistance, then the diagnosis will be decreased bathing or grooming abilities related to general body weakness. Is that okay? Great. So decreased bathing or grooming abilities related to general body weakness. Okay. Then with the objective, patients would be assisted to bath and care for her mouth within 45 minutes, as evidenced by nurse observing patients looking clean and well groomed. All the patients on the orthopedic ward D, they are male patients. So assess the strength of patient, assess a trolley for bed bathing and oral care. Bath patients, treat pressure areas, explain the importance of personal hygiene, and then change soiled linen from side to side. Okay, great. Now, I also mentioned that you can touch on anxiety.
Hello,
Okay,
sir.
you can. Yes, please. Belinda.
Sir. Yes, sir. Good morning.
Good morning.
Sir, please, with this diagnose the wound, the
Yeah.
outcome criteria, is it possible that you reduce the time, or you have to do it days, for days, within days?
Okay, if you are
Or it has
doing
to be
within
within the
days,
time that
okay,
they are doing the
listen,
clear plan?
let me tell you how sometimes some of you can lose marks on the objective to outcome criteria. Instead of getting the one, you can end up getting half. If you are using days and we check your evaluation and the evaluation you've not written partially met, you end up getting half at the objective and outcome criteria. Are you getting
Oh,
it?
okay, okay.
Because once you touch on days, some people will write throughout hospitalization, but you check their evaluation and they've written go fully met. You get it? Then
Yes,
it
sir.
means you've contradicted at the objective level. Okay,
Okay.
that is why I will always advise you that stick to, because sometimes I see some of you will write, you can write an objective like patient wound would show signs of primary intention healing within 3 days. What you should know is that 3 days that
Yes.
you are using, you can't evaluate. You will not be there to evaluate. So we are expecting to see at your
Okay.
evaluation side go partially met. Okay, so I'll always check. The examiner
Okay.
will always check the calculations you've made. If at the evaluation side, you've written goal partially met, then fine. The examiner will now give you the one at the objective. But if you wrote something
Okay.
like throughout hospitalization, or you wrote something like within 3 days, then the evaluation side, you've written goal fully met, then the examiner will now deduct you half from the objective. You
Sure.
get, meaning
Okay.
your objective was not smart enough.
Okay.
Okay, so fine, you can have that kind of objective. It's fine, it's good. But once you write that, remember that the evaluation you should write goal partially met.
Okay, sir.
You get it? That
Yes,
is
sir.
fine. That
Thank
also
you.
applies to the self thing. Some people will write that patients would be able to bath, or patients would be involved in self-care activities throughout hospital. It's fine. But the moment you write something like days, or you write something like 72 hours, 48 hours, the evaluation, we are expecting to see goal partially met over there. And that is a lot of error people are committing. So someone can get like 18, 19, then those petty mistakes. Do you get it? So all these are things you should correct. All right. So I think I touched on the decreased bathing activity. So patient will be assisted to bath and care for her mouth within 45 minutes. You realize that for 45 minutes objective, it's something you can achieve in a short time. So that one, if we are seeing goal fully met, it's logical. But if you are having something like patients will be assisted to bath throughout hospitalization, of course, once we are using throughout hospitalization, it's not something you can achieve that same day. So we should see goal partially met over there. Do you get it? Good, great. So assess patient strength, set a trolley for bed bathing, bath patient, treat pressure areas, explain the importance of personal hygiene, change soiled linen from side to side, or you can simply write change soiled linen. Then if you mastered on anxiety, okay, I mentioned that you can also touch on anxiety, but usually you going in on the fourth day, you should remember your colleagues have been doing, some of them have been writing education, and then anxiety. So I would advise you, fine, you can get into anxiety, but be careful not to touch on knowledge deficit. Is that okay? Please, because this is the fourth day. So people have been writing knowledge, and have been doing education. So be careful not to do knowledge. Okay, but for anxiety, you can touch on anxiety. Fine. You can also decide to touch on knowledge and not to touch on anxiety. But fine, I would advise that you rather drop knowledge and then touch, especially those who are going in on the fourth day. Okay, I will advise you to do away with knowledge deficit. Is that okay? Because by now, people have been writing knowledge over the days. Okay, so you can do patient is anxious of the outcome of condition. For anxiety on orthopedic ward is something that is very common. So if you are sure patient has an impending surgery, then you can write patient is anxious of the outcome of condition and hospitalization. Or if you are sure patient has an impending surgery, patient is anxious of the impending surgery. Don't write patient is anxious. Never. Don't write patient is anxious of condition. Never at all. Is that okay? Great, fine. But if you are lacking, if you are in a position where you are lacking the fourth problem to write, and instead of submitting the paper empty, please write the knowledge there. Because you know the front page, you are supposed to write 4 problems. You are in a situation, you are lacking points. Instead of submitting empty space there, you write the knowledge deficit there to occupy the space. That is better. Do you get it? Not to say by hook or crook, go and write knowledge deficit. But if you are in a position where you are lacking the last point, the last problem, you can chip that there to occupy the space. Okay, great. So that is it for, and I know you guys are already familiar with the diagnosis for anxiety, excessive anxiety related to unknown outcome of condition. Patient level of anxiety would reduce within 40 minutes, as evidenced by patient verbalizing that he is no more anxious and nurse observing patient looking calm in bed. Reassure patients of the competency of the health team. Assess patient's level of anxiety. Explain the need for hospitalization to patients. Introduce patient to other patients with similar conditions who have recovered successfully. Allow patient to ask questions and answer them tactfully. Is that okay? Then that's for the knowledge. The diagnosis for knowledge is inadequate health knowledge related to lack of exposure to disease condition. Then you bring the condition into brackets hernia. If it is a fracture, into brackets so and so fracture. You write it there nicely. Then the objective stroke outcome criteria. Patients would gain adequate knowledge on condition within 40 minutes of education, as evidenced by nurse observing patient, correctly answering questions asked on condition. Nursing others. Assess the knowledge on condition, educate patients on condition in a language he understands, educate patients on the causes, risk factors, signs and symptoms, and preventive measures of the condition. Allow patients to ask questions, answer patient questions tactfully. Okay, so what we've done, the pain, the acute pain, the problem with the wound, okay, and then the self-care is something that is very common at the orthopedic ward. It's something you should be expecting, okay. But apart from that, other problems that you can meet is patient is bedridden or immobile in bed. For example, they give you an aged patient, okay, an aged but extremely weak patient who is just in bed, or a patient with something like a pelvic fracture who is just in bed. Those patients, you can write patient is bedridden or immobile in bed. Then the strength would be patient can tolerate too early turning in bed. Is that okay? The diagnosis will not be impaired skin integrity. It will rather be risks for impaired skin integrity, into bracket pressure sore, related to prolonged lying in bed. Is that okay? Patient pressure areas will be treated within 45 minutes, as evidenced by nurse observing patient pressure areas being treated and looking intact. Then you write your nursing orders. Assess patient pressure areas. Set a trolley for treatment of pressure areas. Treat patient pressure areas every 4 hours. Change patient position every 2 hours. Encourage patient to take in adequate fluids. Change felt linen from side to side. Nicely as that. Is that okay? If you wanted to touch on eating, patient cannot eat, especially they give you patients who have fracture of the upper limb or any weakness in the upper limb, problem in the upper limb, a patient with stroke, any patient who is having a problem with body weakness. One of the things you can touch on is patient cannot eat without assistance, or patient has not eaten. I would advise that you always go with the patient cannot eat without assistance. Then the strength will be patient can sit up in bed and has appetite for food. Do you get it? Patient can sit up in bed and has appetite for food. It's a strength. Is that okay? So if the patient is that weak, aged patient who you think, patient with fracture of the upper limb, stroke patient, you think patient cannot eat without assistance. Strength, patient can sit up in bed and has appetite for food. Okay, then this is how you are going to write the nursing diagnosis. Decreased feeding abilities related to weakness in the upper limbs or general body weakness. Is that okay? Then the objective will be patients will be spoon-fed within 30 minutes, as evidenced by nurse observing patient, tolerating about 70% of food served. The nursing orders assess patient's appetite for food, set a tray for spoon feeding, assist patients into a sitting up position, serve patients, and encourage her to eat. Remove all nauseating articles from her bedside. Plan diet with patient, family, and dietitian. Is that okay? Great. So basically, that is it. So you can have other problems like loss of appetite. Okay, all those problems too are there. Okay, great. So if the patient is having issues with loss of appetite, remember that is different too. That is different. If patient has loss of appetite, we have a way we write that one too. If patient is on NG2, we have a way we write that one. So if patient is on NG2, you see this is how we write the nursing diagnosis. Risk for imbalanced nutrition, less than body requirements, related to difficulty swallowing. Okay, patients would be tube fed within 40 minutes, as evidenced by nurse observing patients being tube fed. I think I've touched on all these before. Let me quickly take you to problems with problems like constipation, and then problems like loss of appetite. So if patient is having loss of appetite, patient complains of loss of appetite. You see that one is different from patient cannot eat without assistance. So, okay, how we write the diagnosis for that one is different. See how we write the diagnosis for patients who cannot eat without assistance. Decreased feeding abilities related to weakness in the upper limbs. Okay, but look at how we write the diagnosis for, because I see a lot of candidates using the diagnosis for loss of appetite for patients who cannot eat. They are two different things. So a patient who cannot eat without assistance is different from a patient who have loss of appetite. They are two different things. So the diagnoses are different. Okay, so look at how we write the diagnosis for loss of appetite. You see, okay, rates for imbalanced nutrition into bracket less than body requirement. That is the loss of appetite. And the mistake some of you make is that they write rates for imbalanced nutrition less than body requirements related to loss of appetite. No. So it means you've related the problem to the problem, because the loss of appetite is what you've written as the problem. See, look at it. So the candidate will write patient complaints of loss of appetite. It's correct. That is the problem. But always remember that the first part of the nursing diagnosis is standing in there for the problem that you've written. So that means that the risk for imbalanced nutrition less than, but is standing in there. It is representing the loss of appetite. So if you write that first part and you come and relate it to loss of appetite again, you've related a problem to a problem again. Is that okay? So rates for imbalanced nutrition less than body requirement related to the disease process. Okay, so patients will demonstrate improved appetite within 24. So you see, I use 24 hours. So check my evaluation, go partially met. Do you get it? Some people will write it all right. They can write, and I see people writing, patient appetite will be restored within 30 minutes. How? What magic are you going to do? That patient's appetite will be restored within 30 minutes. No. Always do something like 24 hours. Yeah, that is logical. Okay, then the evaluation you can write go partially met. It's not a problem. You still be marked correct. You get it? Excellent. So that is it for the loss of appetite. Let's see for the constipation. If you touched on constipation, this is something you can consider. Constipation related to reduced bowel motility and decreased fluid intake. So patients will be relieved of constipation within 48 hours. You see that one too, I have go partially met. As evidenced by nurse observing patients pass a soft forms to and patient verbalizing that he is no more constipated. Is that okay? Great. Monitor bowel movement, encourage adequate fluid intake, promote high fiber diet intake, assist with short walks in the ward. Okay. Then prescribes stool softness were given. Administer prescribes stool softness, encourage ambulation or range of motion exercise, educate patients on avoiding prolonged suppression of the urge to defecate. You get simple as that. Is that okay? So these are all problems that you can touch on. You can get like constipation, like loss of appetite. You can even master on general body weakness. Okay, so listen, once you find out that patient is having a fracture, okay, if you want to dodge knowledge, but then you want to keep anxiety, is fine. One of the things you can do is you can write the pain, you can write the wound. Okay, patient has wound at so and so part of the body. You can write anxiety. Then if you are lacking points, you can write patient complaints of weakness at the lower limb. Okay, patient complaints of weakness at the right leg. Do you get it? You can master on that if you are lacking a point. Okay, great. So I think I'll end here with the nursing care plan. Okay, this will be our last session on the nursing care plan. So I think I may have another meeting with you either this evening or tomorrow morning. Then I will start straight with the Viva Voice so that we can have a very good discussion on the Viva Voice. Okay, then I can address so many areas that you should be expecting questions from. Is that okay? Great, fine. But if you have any issue, you have any challenge regarding the world that you are going, you are thinking of writing any problem, you can ask that question on the page. I'll address all of that. Okay, all the best today.
Thank you, sir.